Hey everyone, I'm going to give you just a second so that we can get everyone on live who is going to be able to catch it live. I know evenings are super difficult, especially for moms, to get on during this time, so that's why I always like to post the recording so you can go back and look and then also take notes because I will be covering a lot of content as well. But I will give everyone just a second while I get to where I need to be on my PowerPoint here. And then go from there. Okay, just to be respectful of everyone's time, I'm going to go ahead and get started. So for those of you who don't know me, my name is Erin Nolan, and I am a registered nurse, and I educate on natural and holistic alternatives to modern medicine as well, to use as an adjunct. So obviously, as we're talking here about labor and delivery and postpartum, vast majority of Americans do deliver in the hospital. So these are essential oils that you can either do at home if you do home births, or at a birthing center, or at the hospital where you choose to deliver. I delivered my son in a hospital setting because we were rural and didn't have a whole lot of options, but I am choosing to, again, deliver in a hospital because of some potential complications with my son, with the son I'm pregnant with now. So out of safety and concern for that, we are choosing to do a hospital delivery again. So with that being said, these are essential oils that I'm going to be taking with me. I am almost 30 weeks pregnant, and I've already have my little bag packed with all my different essential oils in the kit that I'm going to be taking with me. So I want to tell you what I'm going to be using, how I'm going to be using it during labor, during the actual delivery process, and then directly after labor as well, and how I'm going to incorporate those essential oils and have a very different experience this time, hopefully. My labor experience last time was very, very long. My son was born completely safe and fine, but it was a very long, drawn out process. My water broke, and it still took 16 hours after my water broke, even with Pitocin, which I did not want, but we ended up having to do. And then ended up pushing for 2 hours. So all of that being said, I plan to see what natural alternatives I can use this time to help expedite and help make everything move a little bit smoother and a little bit more comfortable this time, as well as the emotional aspect of delivery, not just for you, but if you have a husband in the room or if you have family in the room, just the atmosphere in general, the atmosphere that you bring the baby into. There's studies that show high adrenaline, high stress environments actually affect the baby very negatively. So we want to create a very healthy environment for the baby as well. So to go ahead and jump right in, I did cover a lot of this information in the first class that I did, which was specifically on pregnancy, but on this one I'm just going to breeze over it real quick just in case anyone did miss it. But what is an essential oil? An essential oil is a plant-based oil that is extracted for medicinal purposes, and this oil that you can extract from the medicinal plant can vary based off of where you're extracting it from on the plant. So the exact same plant, you can extract an oil from the root, the bark, the stem, the leaf, the flower, the fruit, and get very different medicinal properties. With that being said, each oil has different medicinal properties that we use for different reasons, and I'm going to go over some of the oils that I consider the core oils for labor and delivery and healing as well. And why would we want to use essential oils? Especially like I was saying, I'm choosing to go to a hospital to deliver my baby. Why wouldn't I just use what I have available at the hospital? Why would I take oils with me? That seems silly, right? Well, like I said, I want to create a very calming and natural environment for the baby to come into. And then also I can tell you, I was very sick and very nauseous and had lower back pain. And like I said, it was a very long labor. And there's a lot of different areas that essential oils can help as an adjunct to labor. Or if you're trying to have a completely natural labor where you do not want any intervention at all, then obviously essential oils would be something that would be very beneficial for you as well. And as the postpartum part, I can tell you, I was completely unprepared for the healing process afterwards, for the pain that was associated with the healing process afterwards and how long it would take, and really my reaction to what that was going to be like. So I can tell you, I am doing a ton of research, or I have done a ton of research so that my healing process can be completely different next time as well. So natural solutions, specifically essential oils, another reason we like to use them during labor, delivery, and healing is they work extremely quickly. So when we're talking about specifically using them on an area of the skin, they can be absorbed quicker than their synthetic counterparts or synthetic solutions. So they work quicker and they worked more effectively because our cells recognize them as natural, so they accept them into the cell quicker. So they work faster for us and they worked more effective as well. And then there's also typically less side effects. Essential oils are extremely easy to use. You really can't mess it up. You're going to dilute it with a carrier oil or diffuse it. And any way you choose to use it, it's a very safe alternative for you to use specifically in this setting as well. So let's go ahead and get started. Talk about the 3 ways that we use essential oils quickly, specifically in labor and delivery. Aromatically, that's going to be a huge way that we're going to use essential oils. So when I talk about using them aromatically, you're going to want to take a diffuser with you. This is in my bag packed already, and a diffuser is specific to essential oils. This is not a humidifier, it's not a burner. You put water in it, put a couple drops of the essential oil, and it disperses it just like a nebulizer or an inhaler. And what this does is science has proven that when we inhale certain aromas, that it actually impacts our limbic system because it goes through our nasal cavity to our first cranial nerve, which is our olfactory bulb, directly into our limbic system. And our limbic system is a structure, different structures in our brain that are tied together that house our emotions, how we react to things, how we remember things, and how we can calm and soothe ourselves also. So smell is a powerful, powerful, powerful tool for your emotions and how you're going to react during labor, as well as once the baby's born, how the baby reacts and how the baby's born as well, and the environment I was talking about wanting to create for both you and the baby and the bonding once the baby does come out. Topical application. Another way that we are going to be using them is topically, and I'm going to go more in depth into each specific area that I'm going to be talking about during the labor and delivery and the healing process and how we're going to be using them topically. And really during the labor and delivery process, we're not really going to be using them internally. The only time we would potentially do that would be peppermint, and I'll talk about that whenever we get to that topic in a second. But really the 2 main ways we're going to be using them during labor and delivery is going to be aromatically as well as topically as well. Hey, Carrie, you better tune in. You need this quicker than I do, this information. Okay, so the first thing we're going to talk about is anxious feelings. So I can tell you when I had my son, that was my first child, I had no idea what I was walking into. I knew what I was walking into was going to be painful, but beyond that, I didn't know what to expect. I didn't know how long it was going to last. I didn't know. I mean, you just don't know anything. So you can prepare as much as you can, but you're still unprepared whenever that time comes. So you get very anxious. And then I worked at the hospital that I delivered in, and I remember when I checked into the emergency room, that's the emergency room that I worked in, so all my friends were there wanting to take pictures with me and be like, oh, hey, how are you? And I was just like, oh my God, I'm in labor, my water broke, get me upstairs. So you're very anxious and you have a lot of emotions going into it. So my recommendation for that and what I would do in the beginning stages when that's happening is your diffuser, of course, which I've already talked to you about, and you're already going to have this in your bag and you're going to have it in your room ready, and your husband or whoever's in there with you is going to just know to go ahead and get this started for you. The essential oils you would want to use are obviously going to be lavender. Lavender is a very mild and soothing essential oil, and this is very sedating to the nervous system, specifically for anxious feelings. Another one that's really good and lots of research supporting its use in this type of situation is also wild orange. So you can use them together, you can use them individually, whichever one you start to you smell and feel like is working best for you. Serenity is a blend of essential oils. The base of it, the main base of it is lavender. So again, it's Serenity because it's very calming and relaxing. This is actually a blend that you use to help you sleep, but in this situation, it's very good at soothing and calming. It's very helpful for the baby as well when the baby comes out. So that's one that I have packed in my bag. One that you can use on you topically, because I feel like this blend doesn't diffuse as strong as it is whenever you use it on you topically, that I have pre-made into a roller bottle, is going to be Balance. And Balance is one that is grounding to me and really helps just calm me down when I feel overwhelmed. So I use it on my chest, on my neck, I use it on my pressure points, and then also on my wrist as well. Some aromatherapy blends that are very helpful during this time would be Peace and Forgive. Forgive, I know sounds weird because you're like, who are you forgiving, right? But there's actually a lot of research that's coming out about the blend Forgive specifically and its ability to help with anxious feelings and feelings of being overwhelmed. So don't let the name throw you off. Look at the science and the research that's actually behind it and why you would want to use that blend. Forgive is one I would definitely pack with you during this phase when you're initially feeling anxious, or in the beginning stages when you're laboring at home and you're feeling anxious. So Peace and Forgive are the two aromatherapy blends that I would recommend. Okay, Carrie's saying, have you heard of hospitals being weird about bringing your diffusers? I have not. I've actually seen tons of pictures, especially in our support groups, about people taking their diffusers. As long as it's not a burner, that's when they start having issues, and you should obviously never use a burner with your essential oils anyway. So as long as there's not heat associated with it, I've never heard of anyone having issues taking their diffuser to L&D with them. Forgive your husband. I know, as soon as I said that, I was like, you're probably thinking you need to forgive your husband around that time period, but I'm not going to go there. Okay, so next, let's talk about energy. So another thing I noticed when I was going through labor with my son, since I did say it was a very prolonged period of time that it was happening, I started noticing that I would have these ebbs and flows, not only in emotions, but in my energy level. Like I would feel very like, okay, I can do this. Let's keep going. I can do this. Let me change positions. Let me move. And then there's other times where I was just like, I just need to pass out and sleep. Like I can't, I'm feeling fatigued. I just feel like I can't keep going. So in a situation like that, when you're needing to continue to energize yourself, because remember, this is a marathon, it's not a sprint in most cases, you would want to use citrus oils and peppermint. Those are the two that are going to be energizing for your limbic system as well as for your cells in general. Eliza said she brought her diffuser with her. And that she would have punched them in the face if they didn't let her take them. It's probably going to be me. But no, I've heard that they're all very accepting, and I've seen lots of women take their diffusers with them. And then if they don't, then just use them topically, or put them on the sheets. That's what I did on the airplane when I was having anxious feeling and emotions, and I was still needing that aromatherapy, and I was on the airplane. I had a blanket, and I was just putting it in the blanket and like smelling it that way. So just as long as you're stimulating the limbic system, that's helpful. So energy, citrus. So we're talking about any citrus oil. Research has proven this, but the ones that are best typically are going to be your grapefruit. There's another blend called Citrus Bliss where it's several different citrus oils blended together. Lemon's very energizing, and then peppermint. Peppermint by itself. So this is when I said the only time I would really consider needing to use an essential oil internally during the labor process is probably for energy or for nausea, and this would be for peppermint. So peppermint I would take internally. You can use the beadlets, which is 1/4 of a drop, already in little beads that you can use that way, or just take your peppermint and actually just open it and put it directly on your tongue that way. Another really great blend to help energize and motivate you, because this is what we need right now, is motivation. If we're ebbing and flowing in our different emotions and how our energy level is going, is Motivate. Motivate's a great blend to take to with you. And remember, you can dump your water out of your diffuser and switch around, like as your emotions start to cycle through or your energy starts to cycle through. Continue to change what's in your diffuser, or continue to change what's on you or what you're diffusing on your sheets. Do whatever works best for you, or your diffuser necklace if you want to take a diffuser necklace with you. So I kind of jumped ahead here. Nausea. This is something I really dealt with when the contractions would come. The pain was so severe that it immediately caused me to become nauseated and vomit. So anytime you're starting to get nauseous feelings, peppermint. Peppermint, 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 peppermint. Hands down, this is going to be the best tool that you can take with you. Other ones that you can apply topically would be ginger, is a really good one to help soothe the system. And then Digest Zen. Digest Zen has a very strong aroma to it, so that would be one that you would potentially want to put on the bottom of your feet so that the smell of it doesn't make you nauseous also. Some people love the smell of fennel or black licorice, which Digest Zen has that in it. That does not work well with me when I'm nauseous, so I have to put it on the bottom of my feet, put my socks on, and then that way I'm not feeling nauseous from the aroma of the fennel or the but it works so well that I would say still take it with you and use it on the bottom of your feet, because it's a game changer for sure. But peppermint is definitely one. Smelling the peppermint and using the peppermint internally will be very helpful for your nausea. So let's talk about helping the muscle contractions and helping the muscles work correctly, your uterus work correctly, especially if you're first time. having a baby, or if you know, like me, I know I have extremely long labor periods. What can I do to help that process along? And there's several essential oils we can use, but the two that have the most research behind it and support the most use during this phase is clary sage and then jasmine. You can use them individually, you can mix them together, but clary sage is one that you would want to dilute and rub topically all over your abdomen. And then also you have pressure points on your ankles. It's not actually the bottom of your feet, but it's actually on your ankles. And I will post this graphic in the group page that I created, but you would want to place the clary sage directly on those points on your ankle as well. You can diffuse it if you want to. My recommendation would probably be use aromatherapy in the actual diffuser and then put the clary sage directly on you. And that way the aroma doesn't get all messed up and not doing what you want it to do as far as stimulating your limbic system. Jasmine, so jasmine you can take with you. That's in a roller bottle. It's a touch system that looks like this, so it's pre-diluted, that doTERRA makes, in a roller bottle. So you would just want to take it off, put it on those pressure points that I was telling you about on your feet, and then you can also rub on your lower abdomen as well. Is Clary Calm Roller okay? So I would use clary sage. Clary Calm does have clary sage in it, but also has other oils in it, and right now we're wanting the power of just clary sage. So my recommendation would be to get the clary sage and just do that by itself, specifically during this point where we're really wanting the muscles to contract effectively. We want to give it as much power as possible. The third oil that you can choose to use during this phase as well is ylang ylang. So that's a third oil you can use to adjunct as well with these other two oils if you choose. Next, let's talk about lower back pain. Thank you, sweet baby Jesus. I really did not have this issue in labor with my son at all. I've had several friends who are like, oh my gosh, I had back labor, or if the baby presents flipped the other way, which is called OP, that can be extremely painful. I did not experience that, but I'm kind of preparing for that because my son does have clubfoot, and I've read a lot of research that clubfoot babies tend to present this way, OP, which causes a lot of back labor and a lot of back pain. So I've been doing a lot of research on this topic. And what I want to say here is talking about essential oils during pregnancy and the ones that are safe during pregnancy, and talking about essential oils and what's safe during labor, we're kind of throwing the rules out the window here, right? Because the baby's about to come out, so we're not really concerned about the oils that we're putting on our body directly impacting the baby long term, like we are with long-term use during pregnancy. So with that being said, during labor, it is totally okay to use deep blue, and it's okay to use wintergreen. And so in this situation, you would want to put deep blue on your lower back. Eliza's saying she had back labor with William. It was horrible, and the contractions never stopped. There was no rest for 32 hours. So this is kind of the example. Some women like me and Eliza have extremely long labors, and if this is you, you just want to have these tools, especially at home, in the beginning phases at the hospital, and as adjuncts in the hospital, you want to have these tools to help you along the way. So deep blue, you're going to put it directly on your lower back. It comes in an oil, it comes in a roller bottle. I love the rub. So you would put the deep blue and rub it on the lower back. The rub's just like a lotion. Basically, it's pre-diluted, and you just put a very small amount on the lower back. Research has proven that if you mix black pepper and basil together, that's really good for back labor. So that pain, basically what you're feeling is not only the nerve pain of things that are going on inside, but also extreme pressure against the lower part of your back, your sacrum, and your tailbone. And just everything in the pelvis stretching can cause extreme lower back pain. So the black pepper and the basil are very good as well to use in addition to the deep blue. You can layer them, or if the deep blue by itself works great, wonderful. Or if the black pepper and basil by itself works great, wonderful. You don't need to layer it. Just see what works effectively for your lower back pain. Another good oil to help the muscles relax, if you start to notice that the lower back pain is starting to cause muscle spasms or starting to cause tension in the lower back, I would recommend using a blend called Aroma Touch. And this is actually the massage therapy blend that doTERRA puts together. And the reason I would recommend this is because, one, it helps with muscle spasms, it helps with the tension feeling, it helps increase blood flow to the musculature in that area, and then also just helps decrease the discomfort and the pain that you're experiencing in the lower back. Next, let's talk about headaches. So, or head discomforts or tension in the neck or just anything that you experience. I know being in pain, a lot of the books and a lot of the training I took was talking about muscle relaxation and keeping all of your muscles completely relaxed, especially in your face and in your neck, because all of that tension in your face and in your neck actually directly controls how your pelvis relaxes. The science and the research behind that is super strange, but it's legit and it's real. So keeping your face very relaxed and your muscles and your shoulders very relaxed. But it's very hard when you're in extreme pain to do that. And I can tell you from experience, I was just kind of like, stop telling me to relax my face. When my mom and my husband would tell me that, I'm like, I'm in so much pain, I can't. It's very hard. So this tends to give you head discomfort or discomfort in your shoulders. So when you start to notice that, again, I would use the balance. The balance works really well. Aroma touch works really well for actually relaxing the discomfort in your necks. But as far as actual head tension and head discomfort, I would use peppermint, the roller bottle again. So if you have it in a direct oil, just make sure you dilute it and you're not putting peppermint directly on your skin. You would want to dilute it with a carrier oil. And a carrier oil is just any vegetable-based oil that you mix an essential oil with so that you're not putting it directly on your skin. You do that for a couple reasons. One is because you want to dilute it, because essential oils are extremely potent, and especially peppermint is extremely potent when you put it on your skin. And another reason is because you actually want it to sit on the skin where it is and not evaporate off. Essential oils evaporate very quickly. So for it to sit on your skin and actually penetrate down into the skin and into the muscle and into the tissues and into the blood supply, you need to dilute it with a carrier oil. So for peppermint, I would put it along the hairline here, specifically the temples, and along the hairline on the back of your neck as well. Very helpful. So let's talk about the perineum and the actual compresses we want to use during labor. So now we're laboring, we're getting closer. They're telling us we're more dilated. We're getting closer to needing to push. We should already be preparing for pushing. And what I mean by that is you should already have warm compresses on the perineum to help get that skin and that tissue ready to stretch, because we don't want tearing. We want to prevent tearing. So a really great tool for this, and my doctor that delivered me was really good about this and was really good about stretching, but also warm compresses. So getting a warm washcloth, if you don't have the luxury of having a water birth, which really helps with the stretching also, but if you can get a warm washcloth and make sure you keep rotating it out to keep it warm. And then you want to put a couple of essential oils on there. One is geranium. Geranium's a really great tool to use. And then another one, if you have helichrysum, that's another one I would recommend using as well. But specifically the geranium is so important. So warm washcloth, dilute it in a warm bowl or basin or whatever you have, put a few drops of geranium in there, soak the washcloth, rinse it out, and then put it directly on the perineum. And you want to keep it there basically at all times and let the warmth, the blood supply increase, let the warmth, let the tissue stretch, and then that way when it is time and they're like, okay, we're good, we're ready, let's start pushing, your skin down there and the tissue down there is ready to stretch. Huge tip, definitely recommend doing it. I actually learned about that one in nursing school, so I'm really happy that my nursing school did teach me about different natural ways to help prevent tearing. So let's talk about women who have C-sections or know they're going to have C-sections, or those of us who don't know that they're going to have C-sections and then end up having one for an emergent reason. So in a situation like that, aromatherapy, again, we need to talk about the essential oils we can diffuse leading up to that if possible, or especially after that, because it's a very traumatic event, especially if it's unplanned. But also C-section care. So we're talking about an actual incision that has gone through nerves, that has gone through connective tissue, that has gone through muscles, and then obviously has gone through our skin. So there's going to be a lot of healing that's going to be involved with C-section care, and that's going to take a while. And I strongly advocate C-section or vaginal delivery, whichever one you end up having, you need to be assessed by someone other than your OB. And they're called women's physical therapists who actually know how you're supposed to be healing, know how the nerves are supposed to be healing, how your pelvic floor is supposed to be healing, and they can test and assess and make sure that you are healing correctly. So for C-section care, the actual incision itself, frankincense and copaiba are two wonderful essential oils to help tissue, repair, regenerate, and anti-inflammatory. Frankincense is actually, we call it the king of all oils, right? Because they brought it to baby Jesus. But here's a cool little fact. The reason that people in olden days, such as biblical days and Egyptians and all back thousands of years ago, the reason that they would actually take frankincense postpartum is not just as a gift, but actually to help the mother heal. So frankincense is really important for healing tissue, like I've already said, but specifically for C-section care. And we're going to talk about frankincense a little bit more when I talk about postpartum healing as well. So frankincense, lavender is a great soothing and anti-inflammatory. So if you start to notice that you're getting red, make sure obviously it's not an infection, but any redness or any itching that can be associated with the healing process, lavender will be very helpful for this. Helichrysum, again, is another one that's going to be great for skin regeneration and healing and tissue and anti-inflammatory. These are going to be the oils that you use initially. So obviously, depending on how they choose to close the actual incision, if they're using staples or if they're using glue, you don't want to put essential oils directly over the glue. But depending on how they do that, you want to encircle basically the incision and make sure the tissue or the skin around the incision is well kept with these essential oils. Then once the actual scab and the actual the healing process has started to take place, two oils or two different products that I would highly recommend for the healing process initially is going to be this. I don't know if you can see this. Okay, there you go. It's called CorrectX. And this is a non-petrochemical based ointment that you can use to help with skin healing. And the essential oils are frankincense, helichrysum, cedarwood, melaleuca, and lavender. So I would highly recommend using this. And then the other one that I have read a lot about and seen several women use is a roller bottle that's called Immortelle. And Immortelle has several different essential oils. It has frankincense, Hawaiian sandalwood, lavender, myrrh, helichrysum, and rose. And rose is a wonderful oil to help with skin regeneration and rejuvenation as well. So if you're worried about scarring and how the tissue is actually going to come together and heal long term, Immortelle is going to be a great roller bottle to use directly over the incision once the healing process has begun as well. Let me read some of these, make sure I'm not missing any questions here. Okay, so next, let's talk about bonding. So research has suggested C-section or vaginal delivery, the quicker you can get the baby directly skin-to-skin contact on the mother, the better outcome the baby has, health and mental health, as well as the bonding, which is so important for babies and their ability to thrive and to deviate from failure to thrive. So bonding is extremely important, especially when the woman's hormones are fluctuating. I've heard stories of women just being like, I couldn't bond with my baby right away. I was having some detachment issues. So we want to avoid that, and we want to make sure that the bonding takes place and that it takes place correctly. So research has suggested two essential oils are really, really great for this. One is geranium. So I would use geranium, I would diffuse it, and I would use it topically as well. Another one is rose. Rose comes in a roller bottle pre-diluted. So this is one I would potentially put on the feet, the bottom of the feet, so it can absorb into the blood system through the bottom of the feet, but also use on your neck and on your different points so you can actually inhale the aroma in addition to the rose getting into your blood system. And remember, we talked about rose being wonderful for skin regeneration and healing anyway. So those are the two essential oils I would recommend for that. So let's talk about the baby for a second. Now the baby has come out. Something that is really great for the baby, and something I wish I knew, because they actually had to surgically remove my son's belly button because he was having issues falling off and then it just wasn't looking right. So to prevent that in the future, some research I have been doing on how to prevent that and what to do is to put myrrh on the stump of the belly button. So we choose not to use petrochemicals in our home. So instead, what I would do on the belly button, and typically they say not to do petroleum anymore, or petrochemicals, or any type of jelly or anything like that back like 20, 30 years ago, they used to say that about the belly button. They don't say that anymore now. They say use alcohol. It's very drying. Instead, what I'm choosing to do is use myrrh, diluted, and just put a little bit of that around the stump of the belly button and help it that way. Myrrh's very antimicrobial, and it also helps with the healing process as well as making sure it stays healthy as it's falling off correctly. So that's just a little tidbit there. So let's talk about moms who choose to nurse or to breastfeed. So this can be, especially the first baby. I mean, second baby, I don't know that it's going to be much better for me. I hope it is, but it's a very hard trials and tribulations. Each baby's mouth is different. Each baby reacts differently. Some babies are just really good at nursing. Some babies just like to strike a lot, or they just like to not nurse. There's just always differences in the ways that the babies are. So we want to make sure that you are producing correctly and that the baby is attaching correctly. So there's going to be different essential oils I'm going to talk about here if you choose to breastfeed. One, if we're talking about the initial week, can take up to a week, hopefully less than 5 days. For your colostrum is already produced, so that's what's actually coming out when the baby is nursing. But then to actually for your milk supply to come in can take up to 5 days. So how do we help that milk come in sooner and come in quicker and come in more effectively? We would want to, again, use clary sage. So I would not use clary calm. I would use clary sage specifically. And what I would do is I would put it in a roller bottle, dilute it with your fractionated coconut oil, and then actually encircle each breast with that until you start to notice that when you're pumping or when the baby's feeding, that actually milk is starting to come out. Once you notice that your milk has come in and milk is actually starting to come out, stop using clary sage. At that point, assess, see how your milk production is. Some women have a wonderful milk production and it's actually in excess and they start getting engorged and they just have so much to produce. That's wonderful. If you're like me and you struggle with the amount that you're producing and you need something to help augment or help boost milk production at that point, you would want to use fennel and you would want to use basil. And you can use one of those oils, you can use both of those oils together, it's whichever you choose or prefer, and you can mix them again and dilute them in a roller bottle. I would use about 10 drops of each in a roller bottle and then fill the rest up with fractionated coconut oil and then again encircle each breast with it. You don't want to get these essential oils directly on your nipples because you don't want the baby to ingest them directly through the mouth. That's why I keep saying encircle your breast with them. If you do not want to breastfeed, or there's a medical reason that you cannot breastfeed, such as you are on a medication or for whatever reason, or you're trying to wean your baby and it's been a couple years or a year and you're ready to stop breastfeeding, peppermint is the research that is used or that supports helping the breast stop producing milk. Typically, most research actually says that this is through internal use, but there has been some question about potential topical and aromatic use as well. So I tell moms, if you are nursing and you are wanting to nurse and you're wanting to keep your milk supply, avoid peppermint, topical or aromatic. But if you're definitely wanting to make the milk stop producing, then you would want to take the peppermint internally. And that would be as easy as 1 to 2 drops a couple times a day. That way, or you can diffuse it as well and use it aromatically. But we know when we use an essential oil internally that it's much more effective that way. So that's why I'm saying in that situation you would potentially want to use it internally. So let's talk about engorgement or tender breasts. What we would want to do in that situation is use cold compresses. So get a cold washcloth and then soak it in lavender. And then you could use that directly over the breasts as well. And then, if you start to notice that you have any breast tenderness, redness, or any type of concern of how it's coming out, or maybe there's a blocked duct or anything like that, contact me directly. I've actually dealt with that pretty severely whenever I was breastfeeding, and I made a whole long sheet on how to deal with it naturally, essential oils, different techniques on how to get the milk out and how to deal with it, and it was long and complicated. And all the research that I did, I was like, I don't want any other woman to have to do this amount of research ever again, so I just put it all on one sheet. And if that ever happens to you, contact me and I can email it to you so that you can have that and I can help walk you through what to do with it. So let's talk about postpartum sprays and healing. So the baby has come out now, And this is what I was telling you. I was not prepared for this at all. I felt way more prepared for knowing what could happen during delivery. I guess maybe because I'm a nurse, but also because of the amount of research I did. But I was not prepared at all for the healing process or the amount of discomfort I was going to be in afterwards and how long it was going to last, and the healing and the recovery. Everyone says 6 weeks. It is not true. Can be much longer depending on complications you could potentially have. So this is an area that essential oils will be a game changer for me for sure. So a spray, let's talk about, where's my spray bottle? When I keep talking about sprays, you notice I'm always talking about glass. You always want to mix and store essential oils in glass. You always want to make sure that they're dark glass too. That way that the sunlight doesn't actually go into the oil and start to degrade any of the essential oil molecular compounds or the therapeutic compounds in there. You want to protect them. You want to make sure you always keep the lid on as well, and keep it in a cool, dry place. If it gets in your car and gets hot, that can destroy everything in it. So you want to avoid doing that. But let's talk about a spray. So I have this little spray bottle here. It's glass. You can use water. You can use witch hazel, whatever's most comfortable for you as your base, right, to fill it up. And then you add the different essential oils inside of it, and you take it off, and then you have this spray, and it's just an easy spray that you could put for your postpartum healing. So essential oils you would want to mix in here directly for perineum and postpartum healing. Even if you have stitches, you can still use this. You would want to put frankincense, like we've already talked about that and how wonderful that is for postpartum healing. Helichrysum is another one that you definitely would want to put in there. Geranium is great for skin, soothing, helping it moisturize, helping it get healthy again, and the tissue repaired. And then the last one's lavender. Lavender, again, is great for soothing and the discomfort part of it, as well as the puffiness and the redness that may be associated afterwards as well. So you'd want to mix all of those together in here, and then make sure you shake it up each time you use it, and just spray it. I sprayed it every time after I went to the bathroom, just to make sure I was getting a new coat of essential oils on there. I have read of some people using Immortelle. I think, again, this would be very dependent on what is going on down there and what you can and cannot do, and if you have stitches, if you don't have stitches, and how you can best apply the essential oils. That's why a spray bottle is just safer. And I can tell you, postpartum, I would not have wanted to have any type of pressure or touching down there aside from just being sprayed. So pads are another great alternative as well. So as far as pads go, make sure that you are using pads that do not have fragrance, because the fragrance can be very irritating to any open tissue. So if you have any type of healing that needs to take place, or if there's sutures or anything like that, make sure the pads do not have fragrance, because that can be very can cause stinging and irritation down there. So no fragrance, and try and make sure they're just cotton. A lot of times there's gels and other chemicals and weird stuff that they put in pads nowadays. If you can find some that are just cotton pads, that would be ideal and best for creating postpartum pads. And what I mean by that is you would want to, again, pre-mix it. You don't have to do it in a spray bottle, but just pre-mix it in some form of a container where you have witch hazel, and then you can add lavender oil to it, and then you can also add aloe. You can, if you wanted to, you could put some frankincense in there as well, just for the regenerative properties of it. But if we're talking about more so just for discomfort control, that would be a wonderful way. You're going to mix these together, and then you're going to pour it over the pad. So now your pad is saturated with this witch hazel and these essential oils and the aloe, and then you're going to freeze them. Freezing them, I did not like that. I liked them refrigerated. Freezing them was a little too cold, and then it was hard, and then just was uncomfortable. So for me, I put them in the refrigerator, and the refrigerator got them to a cooler temperature that wasn't as irritating, because remember, ice can be irritating to tissue also, and too cold can be just as bad as too hot. So you want to make sure it's a cool temperature that just helps decrease the inflammation down there. So I recommend putting it in the refrigerator, not the freezer. A lot of people do the freezer. I just recommend not doing that. Also, warm baths. So when you go home, they're going to give you a spray bottle that looks like one of these sports spray bottles that the football players use on the sidelines. Looks almost exactly like that. Do not throw that thing away. That is going to be your best friend ever. So that was so helpful for me after going to the bathroom, because you can't use tissue paper because you really can't touch down there and everything's swollen and painful. So what works really well is I would just fill it up with warm water. I would wait till the warm water came through the sink, fill it up with warm water, then go to the bathroom and then just use that to spray and cleanse afterwards. But if you want to, you can also add 1 to 2 drops of lavender and 1 to 2 drops of geranium to that spray bottle as well. And that way that can also help with the healing, and then that can also help with the anti-inflammatory and the soothing and the redness as well down there. So not only are you getting the instant relief from the actual warmth of the liquid and then the cleansing from the liquid or the water, but you're also getting the healing properties from the essential oil as well. So let's talk about bulging veins and different type of bulging veins that can happen anywhere down there after we have babies. And this can happen during pregnancy, or this can happen during the pushing phase, or this can happen really at any point. So to be prepared for that and to have a solution for that is super helpful. And I have found different recipes that people recommend and that have been helpful for them. But the 3 oils that I find that are consistent in every recipe I have found for bulging veins is helichrysum, cypress, and geranium. And those 3 are the 3 consistent ones that I have seen everyone say that they used. So you can use this again in a spray bottle and then spray it directly on the area that the bulging vein is present. And then also you can add some lavender again for the discomfort, and then for the anti-inflammatory, and then frankincense. I just add frankincense to everything, especially labor and delivery and healing. Like, add frankincense to everything because it's going to help. So frankincense is another great one. If you start to notice that it's very painful, or that you're having discomfort or itching or burning or any of those feelings along with the bulging vein, you can add a little bit, just a little bit. You can add just a little bit of peppermint oil to that, and that will help with that sensation as well. After you spray, it'll help cool that feeling as well. So let's talk about, now we've had the baby, we're talking about healing, but now our hormones are completely out of whack and we're kind of cuckoo crazy and we're crying all the time. This is where I tell my patients, I do patient callbacks now at the hospital I'm working at for all of our postpartum women, and one of the things I talk to them about is postpartum depression. And obviously crying and feeling weepy is considered normal, but whenever we start to feel anxious, or we start to feel guilty or overwhelmed or angry or any of these feelings, this is technically considered postpartum depression, and you need to let your OB know because it's totally treatable, but it's very, very common. Close to 50% of women, some studies I've seen, close to 50% of women experience postpartum depression. Some studies say closer to 20 to 30%, but it's extremely common. So please let your OB know if you experience any of those feelings. If you experience feelings of just feeling weepy or tired or just kind of normal fluctuations in mood swings after you have a baby, there's aromatherapy that we can use for that. And we just call those postpartum emotions, basically. So there's tons of research, tons of different blends, tons of different recommendations. I'm actually going to post a graphic that has a few different blends and recommendations that you can use to help with the emotions postpartum specifically. But a few that I want to cover with you guys that I think are very, very helpful in helping not only regulate hormones postpartum, but also to help regulate the hormones that specifically interfere, specifically affect our emotions. And these essential oils are bergamot, which is a citrus. It smells very similar to orange, geranium, frankincense, ylang ylang, and then patchouli. So these essential oils are wonderful for regulating both postpartum hormones, like I said, and helping them level out and produce correctly, as well as the association that has with our emotions. Other essential oils, there's actually new research that is starting to come out about postpartum emotions and rose oil. So again, this is another time I would say whip out your rose oil and use it as perfume so that you can smell the aroma whenever possible. And then citrus oils. Citrus oils, just across the board, when we're talking about our limbic system, when we're talking about emotions, citrus oils, period, are very good at uplifting our mood. So not only our energy levels, but also our emotions, and helping to reduce the anxious feelings that we may be feeling. So this can be lemon, this can be lime, this can be grapefruit. Bergamot, again, is considered a citrus oil. Citrus Bliss is that blend I was telling you about. So any citrus oil that you can get your hands on, this would be another time that would be beneficial for you to use those. So when we're talking about this whole process we just talked about here, where we go through the labor, we go through the actual pushing phase, we're now in the postpartum phase. Our body has been through a lot. And now at this point, we're pretty exhausted. Our body's just exhausted and our cells are overwhelmed on a cellular level. So what can we do to support our overall inflammatory responses and our systemic healing with our body as a whole, with everything that we've just been through? And one is going to be using frankincense and copaiba. So those two essential oils are the ones that I keep talking about because of their inflammatory response and their ability to to aid in systemic anti-inflammatory responses. So those are the two I would recommend diffusing all the time if you can, using them topically every single day. And then when we're talking about actually helping our hormones regulate postpartum, I went through some that just a second ago that we're talking about specifically associated with our emotions and our mood, but talking about more specifically with helping them re-regulate back into a normal level. We're talking about clary sage, ylang ylang, bergamot, frankincense, and geranium. So you'll see that there's some overlap there, but those are the essential oils when you're trying to get your hormones back in check after the baby. Those are the ones that we would want to use aromatically and use topically as well. So I can tell you something that was super annoying for me after I had my son is the amount of people who were like, just sleep when the baby sleeps. And I was so sleep deprived. And I was just so frustrated by the amount of people who would tell me that, because I was like, I can't sleep for 15 minutes at a time or 10 minutes at a time. Like, I can't just lay down and go to sleep for like 3 minutes and wake up and then be ready when the baby's awake. Like, it was just very frustrating because my son would nurse almost every hour and would fall asleep for like 30 minutes or typically a lot less than 30 minutes. So I just was completely sleep deprived. So whenever I had the ability to sleep, I wanted to sleep, and I wanted to sleep really good. So there's essential oils that we can use to, one, help the baby sleep, right? Because that's what we want, have restful baby sleeps so that we can sleep. And then also when I sleep, I want to sleep like legit sleep and get restorative sleep. So essential oils that are going to help with that are going to be lavender. Tons of research about lavender and its ability to sedate the nervous system and aid in healthy sleep cycles. And then the essential oil I was telling you about at the beginning of this class is the Serenity blend, which is the restful blend. The base is lavender, but it does have other essential oils in it that is really great at helping healthy sleep cycles and helping to sedate our nervous system, such as vetiver and other oils like that are all baby safe. So these are all safe to diffuse. If you want to diffuse around you and the baby at the same time, it's totally safe to do that. Another one that's really good is Roman chamomile, and this is great for postpartum moms as well as the baby. So those are the 3 oils I recommend diffusing as you're sleeping next to your baby for both your sleep and the baby sleep together. And really that's it. I keep trying to read here, make sure I'm not missing any questions. Hold on. So I'm reading back. Sorry, Liza, I'm just now seeing your post where you're talking about the myrrh when I was talking about the belly button, and you said it came off twice as fast and perfect. So I definitely need to use that on my next son because we had belly button issues. Yes, and then she said she had issues with scented pads afterwards. The fragrance and the chemicals, you wouldn't think it, but they put chemicals in everything, and the chemicals that they put in the pads that are just supposed to help actually increase absorbency as well as help with the scents and things like that, or just they're caustic to your skin, especially when your skin's already irritated and inflamed and open and healing. Do not put scented pads down there. That's not helpful at all. So, she said hashtag diaper rash, an adult diaper rash. So yeah, that's basically what it can do. So I just avoid that if you can and just try and find cotton ones. But if you guys don't have any more questions, what I have already done is, because this is the second video, I did go ahead and post the bundles that I recommend, the core essential oils that are going to help not only through pregnancy, but also the labor, delivery, and the postpartum period to kind of carry you through all of that. One of the bundles is good all the time, so that would be a great baby gift or a great gift to give someone, because the membership with doTERRA is free, which means that they get 25% off all of their doTERRA products for a year. And another thing that means is they get put on my team or whoever invited you, their team, which means they're going to be your coach. So when you have a question at 2 in the morning about how to use this essential oil on your baby or you or while you're in labor, we are going to be the ones that you contact, and you have that ability and that support, which is so crucial when you're using essential oils during pregnancy or during a very serious period of time, such as labor and delivery, and then also on your baby. Please do not use essential oils on your baby unless you have someone coaching you on how to do that, because it's just not safe otherwise. They can be used, don't use them internally. There's several different ways you can use them that we would not recommend for a newborn baby. So that, as well as with the membership, you get a one-on-one consult with the person that you enroll with, and then we also give freebies away. So like I said, I put the enrollment kit that's good only for October is on there, and you get to see all the free oils you get with that one. And then the other pregnancy bundle is good all the time, so that's the one I would say definitely get those as gifts for people. It's so worth it. For the long-term benefit of not only the mother, but also for the baby as well. And if you have any questions about any of this, any of the content that I went over, how to become a member, how to enroll, how to join my team, any more coaching that I provide or members of my team provide as well, contact me and let me know, because we are excited to help you get started and have a healthy delivery and have a healthy baby and have these tools that I wish I had during my last pregnancy and my last delivery. Provide these to yourself and to your baby and to your family and to your friends, and that way we can all be in this together but have a much better experience. So if you guys have any questions, contact me. And in the meantime, thank you so much for joining me. Bye-bye.